My name is Alaa. That's how it's pronounced in Arabic. I am a physician, a woman, a mother, and an advocate. I think those are like the four important pillars about my identity. Oh boy, that's a very long story. I think there was no one clear part of my career that I say like this is where I know 100% that I will be a psychiatrist just before residency. I think that was the clear decision. I think through my journey at my medical school in Egypt, I get to see different specialties, and in the last year of medical school, we get to rotate and actually shadow the residents to get to know what specialty we can choose. And so during my OBGYN rotation, I used to spend a long time in the labor room. And one of the OBGYN residents noticed how much time I spend with supporting the priming ones with their process, not knowing what labor is like, and also being alone in that situation. And he just said, like, "Oh, I think you just should go to site." And it's like, you know what? I'm actually going to site. So I would say that's really supporting people around their hard times. This is where I knew for sure that I will go for psych. I think I started involved in the professional organizations early on my career in the US, around my second year of residency. When I was thinking about going to child psychiatry, I started attending the ACAP meeting. That was in 2016, I believe, in New York. And since then, I've been attending ACAP meeting every year. I joined the diversity committee, which I have pleasure and honor to meet you and a lot of great mentors. I joined the committee of medical students and residents, MSR, and we did a lot of collaboration work around mentorship, um, like just to be able to get to help other people who actually starting their career and wanted to choose child psychiatry. In terms of APA, I think around the before residency, I guess I was involved in the APA as an international person. I did my first psychiatry and neurology residence in Egypt. So APA is the one international meeting that we could go to. So I think I started that in 2014. And during residency, I think the big piece that made a huge difference in my career, I think it's the diversity leadership fellowship. It's part of the minority fellowships that the AP offers. And I got the pleasure to work with many leaders in the field for 2 years and get to actually understand my background and identity. Those are the main two organizations that I will call them like home organization. Support on two other organizations that help with the academic prospects are the AdBird, where like the program directors meets, and I think my work there was around developing an IMG well-being toolkit and educating program directors about what IMG resident would like their program director to support them along the line of their residency. The last was AAP, but we can talk about that later in the interview. When you are in residency, this is the time where probably most of the general psychiatry residents started to think about are they going to child psychiatry fellowship or not. Lucky for me, like I knew that I wanted to do child for a while, but I think to be more certain, I got to spend more time on the pediatric rotations, including pediatric CL and pediatric ER. And I think one of the stories that I feel like it made me more comfortable and confident about the decision of going to child psychiatry fellowship is the pediatric ER. I think doing consults on kids who struggle with suicidal ideation or behavior in the ER just made me think about the perspective of the importance of working on early in diagnosis and intervention during childhood. And it just made a huge difference between treating adults, like understanding that illness that starts early in life and start to get the treatment that they need. So I would say pediatric ER with suicidization, that was kind of like the big one. For our audience who are going to join the field or thinking about joining child psychiatry as a career for the rest of their life, child psychiatry can be uh, one of the most rewarding careers that you ever can imagine. You get to work with families and you actually get to see improvement much earlier than adult, especially with the support system around the kids that they can have, and you can be that part of the support. So that part about the patient care that I would like them to know. I know that can be challenging and tricky for some people because you're actually taking care not just of the patient but taking care of like their families and the caregiver. So that sometimes can be overwhelming, but finding the right fit will make you actually find your right pace. For psychiatrists who are share similar background as me, who are international graduate immigrant and coming from a minority religion in the U.S. I think being in the journey with people who understand your culture and appreciate and embrace it is very important. And understanding your own culture and the impact that you make on the population that you treat is very important through the journey. Not looking to being a different as a weakness, and understand that if you are one of the few, that makes you unique, not weak. I think training can be challenging for both American and non-American residents. I would say the extra burden that can fall into the IMG, especially the non-US IMG residents, is related to the visa, paperwork, and the immigration. Um, there is challenging to all residents that we all know, and I'm not gonna get into it, which is like related to burnout and just the system. But add on to that, just coming to residency and match in a country that you don't know a lot about, you don't have a lot of support system around you, traveling to different cities, that can be very anxiety provoking in the beginning, and finding a program that actually sponsor the visa that you require, and have that visa maintained for like the years of training, is a burden also that sometimes fall into the IMG to be actually the one who figure out all the legal aspect for it, and managing your duties as a resident and as a doctor to add on to them, to be able like to not to worry about your legal status while you're working is a very important stress related factor for a lot of them working by time. Um, especially there is certain times where paperwork got delayed for some reason during COVID, and that has been very stressful. I think one beautiful thing about the ACAP, and it's a very unique aspect about ACAP, is mentorship. And I was very lucky to be involved in the ACAP since 2016. So I think a lot of mentors guided me through the career, either through the diversity committee or during collaborating on presentations and actually offering job interviews after residency. That's actually how I got my job right now after residency. The other thing, it's very, very important for women who likes to have their kids during training, which is a hard decision for some women to do, is to actually um, have a good support system, a partner that actually understand how is it like to be a parent and a doctor at the same time, and be able to schedule your time blocked like in a very smooth way, so it does not lead to shame or guilt around your role as a parent while you're trying to be a doctor. So I would thank my husband for that and just being a huge support. What I enjoy the most about my work is both being a child psychiatrist and a parent. Um, make me understand what impact we have in kids' life in terms of their supporting their mental health. Before I became a child psychiatrist, I always thought about prevention and like we want kids not to have mental illness. But really understanding the mental illness and looking at it as any other other illnesses, I realized like it's just like any other illness, like diabetes, and we should be able to help kids overcome the stigma about the mental illness and focus more in giving them the help that they need, like getting the treatment and the medication that they need, therapy. So I would say I really enjoy seeing kids after getting therapy, medication, and great support from their parents, and seeing them smile and talk about their future. It just made me really happy. And I think that's one unique thing about my type of work. I work in a partial program where I get to spend like actually 6 weeks with the kids from starting the medicine to actually till they actually feel better on it. So I feel lucky that way. I think it has different effects. I think in the beginning, I noticed that some patients would ask me about my scarf and what does it mean to me, and that encouraged me to understand a cross-cultural understanding in the patient-doctor relationship, and how would that affect the psychiatric evaluation of a patient and the trust between them. Later on, I think working with immigrant population has been also a huge difference. So I got to work with teens who their parents got deported, and um, they wouldn't talk about that in the beginning of our work together. And I realized being an immigrant myself, understood how that works, was able to make me ask questions about this during interview, and actually write letters for the patient to support them during their parents' hard time. So I think those are the like things that I feel like most important. But also recently, I have been receiving a lot of consult requests from women and uh, girls in the Islamic community asking about kind of like the mental health and the Islamic community. I know that there is a lot of stigma around mental health in some of the Islamic community in the US. So I think that also has been a great help. Sometimes when they see someone who actually understand their religious identity, it helps with understanding their own uh, journey and their experience with the mental health. In high school, I'd say being the first doctor in my family was something I'm very proud of. The healthcare system in Egypt uh, is still work in progress, and I think having both parents who struggle with chronic illnesses made me feel like how important it is to help by being in the medical field. I would say in college, we have medical school as part of college in Egypt. It's a European system. So I'd say going through the psychiatry rotation was something that very unique and also one of the best places that you can practice psychiatry in the Middle East at ancient universities. So I really enjoyed that rotation, and the case conferences was really interesting, and patients had a lot to share during those meetings. So I would like to thank our audience and to have a message to medical students or residents who are thinking about joining child adolescent psychiatry as their career. It is one of the most rewarding jobs that you could ever have. And you have a huge impact on the mental health of our youth, which in this country during the COVID and after the COVID, it has been a very needed field. So we would love to have you. And if you are a minority position, I'm telling you that you are not alone and you have a lot of mentors around here. So reach out to us if you have any questions, and we would love to see you joining the child psychiatry community. Thank you.